Welcome to Perform Basic Life Support and First Aid Procedures, Section 5. In this section, we will be discussing how to treat common injuries. Heart attack. A heart attack occurs when blood supply, to a part of the heart muscle, is partially or completely blocked. The lack of oxygen to the tissue causes a part of the heart muscle to die. This is known as a myocardial infarction, and may disrupt, or stop heart action. Common symptoms. The patient could have the following symptoms: fear and apprehension, severe crushing chest pain, and pain in the neck, shoulders, throat, jaw, elbows, and fingers. Feeling of indigestion, shortness of breath, pallor known as a patient that is pale, sweating, blue-gray color around the lips, nail beds, ears, and face, shock, nausea and vomiting, possible unconsciousness, and irregular or absent pulse. Treatment. Give lots of tender love and care. Place the person in the half-sitting position. Assist the conscious patient to take prescribed medication. Loosen constricted clothing around the neck, chest, and waist. Treat for shock and maintain body temperature. Alert the emergency medical services and monitor breathing and pulse. Do not leave the patient alone. If the heart stops, start with CPR immediately. Fever. Fever is defined as a body temperature that is 1 or more degrees higher than normal. Normal body temperature differs from person to person, depending on the age, by the time of day, and by the part of the body where it is measured. Factors that can influence the temperature may include strenuous exercise, medicines, or even excitement, can also affect body temperature. The person's temperature can be measured with a thermometer in the mouth, ear, or rectum, or under the armpit. When the temperature is measured in the mouth, a temperature between 97 to 99 degrees Fahrenheit, or 36.1 to 37.2 degrees Celsius, is considered normal. A temperature of 100 to 102 degrees Fahrenheit, or 37.8 to 38.9 degrees Celsius, is usually called a low-grade fever. A temperature of 103 degrees Fahrenheit, or 39.5 degrees Celsius, or higher is called a high-grade fever warning. Generally, oral temperatures of 102 degrees Fahrenheit, or 38.9 degrees Celsius, or higher are fevers that may be more serious. How to measure temperature. A checklist was provided on how to measure the temperature. Step 1. The first aider must use a sterile thermometer. Step 2. Insert the thermometer into the mouth, under the tongue or armpit, or the ear. Step 3. Leave the thermometer in place for 3 to 5 minutes. Step 4. Read the thermometer where the line of mercury ends. Temperatures measured in the ear or rectum are higher than oral temperatures by 1/2 to 1 degree Fahrenheit, or about 1/2 degree Celsius, and temperatures measured in the armpit are lower by 1/2 to 1 degree Fahrenheit. What causes fever? A fever is a symptom and not a disease. Fever can be a sign that the body is fighting an infection, and may occur with viral or bacterial infections, such as ear infections, the flu, severe colds, sore throats, pneumonia, stomach viruses, or urinary tract infections. A fever may also be a symptom of other types or sorts of medical problems, such as dehydration, a thyroid disorder, or an autoimmune problem. How is it treated? When a person has a fever, it does not mean that the person has a serious illness or needs medicine. Older adults may have a serious infection and not have a fever. For low-grade fevers below 102 degrees Fahrenheit or 38.9 degrees Celsius, the person should get plenty of rest and drink lots of fluids, especially water. Dress in light, comfortable clothing. Do not cover the person in heavy clothes or blankets. Keep the room cool but not uncomfortable. Cold injuries. Hypothermia. Hypothermia means the generalized cooling of the body. It can develop quickly when the body is immersed in cold water, or more gradually when the body is subjected to a cold environment for several hours. Signs and symptoms. Altered level of consciousness. Lethargy, unwilling to move. Slow, weak pulse and breathing. Shivering with uncoordinated muscular moving. As condition deteriorates, shivering will stop. And skin extremely cold to touch, with loss of sensation. Management. Remove patient from the cold environment. Check CABs very carefully. Restrict handling to the minimum, when removing wet and cold clothing. Do not massage or rub the skin to warm him up. Cover the body, not extremities, with a space blanket or direct contact with a warm body. Keep patient still and manage shock. The patient must be hospitalized. And only in case of mild hypothermia, a warm drink may be given. No caffeine or alcohol may be given. Frostbite. Frostbite is the term applied to cold injuries, where there is a destruction of tissue by freezing. It is the most serious form of localized cold injury. It normally affects the ears, nose, chin, hands, and feet. Signs and symptoms. Skin appears white and waxy. Skin is icy cold, and affected part is hard to the touch. And the affected area feels numb, but there may be stinging or aching sensation. Treatment. Do not massage the affected part. Start warming body parts gradually with skin-to-skin contact, or lukewarm water. Start with cold water, and gradually make the water warmer until it is lukewarm. Do not expose affected areas with dry or radiant heat. Refer to advanced medical help. Heat illnesses. Heat cramps. It is painful muscular spasms, which occur during strenuous activity, excessive perspiration in areas with high humidity, when the body loses water, and mineral salts. Treatment. Do not attempt to massage the muscle. Remove the patient from the warm environment to a cooler one. Give water, or half-strength isotonic drink if available. Heat exhaustion. Definition. A condition that develops, due to loss of fluids and mineral salts, for example, perspiration. If not recognized and managed, heat stroke may develop. Signs and symptoms. Early signs. Excessive sweating and warm skin. Later signs. Cold, clammy skin. Restless and or confused. Shallow rapid breathing. Faint rapid pulse. Nausea and or vomiting. Fainting may occur. Headache. Dizziness and blurred vision. Muscle cramps. And very thirsty. Treatment. Place person in a cool spot. Manage shock. Remove excessive clothing. Give water or isotonic drink. Heat stroke. Definition. Occurs when the body is subjected to more heat than it can handle, and the normal mechanisms for regulating body temperature are overwhelmed. It is a life-threatening condition. Signs and symptoms. Not sweating at all. Body temperature rises. Skin warm and dry. Confused and or delirious. Rapid breathing. Full and bouncy pulse. Vomiting. Unconsciousness or convulsions. And severe headache. Treatment. Remove excessive clothing. Cool body immediately, for example, in a bath, with garden hose. In a draft, for example, wind or fan. Manage shock. Measures to prevent heat illnesses. Avoid outdoor physical activities during the hottest part of the day. Avoid sudden changes of temperature, for example, air out a car before getting in. Drink 8 to 10 glasses of water when you are working in hot weather. Do not leave old people or children waiting in a car on a hot day. Insect bites and stings. Common symptoms. For most people, insect bites or stings cause only a painful swelling, with redness and itching. A bee and wasp sting, however, may cause a severe allergic reaction in some people. Look for skin eruptions, swelling around the eyes and mouth, nausea and vomiting, and breathing difficulties. When these signs occur, seek medical help immediately. Treatment. Ask the person if they have medication that they take for such a reaction, and help them to take the prescribed medication, if it is available. Apply ice wrapped in cloth. When the stinger remains in the skin, remove it by carefully scraping it, and its attached poison sac from the skin. Do not use tweezers, or anything that may squeeze more poison into the body. If there is swelling in the mouth, or if there is difficulty breathing, watch the person closely. Place him in the recovery position, or any position that makes his or her breathe easier. Seek medical attention immediately. Poisoning. A poison is any substance that can cause illness, or death when it is absorbed into the body. An antidote is a substance that acts against a poison, to offset its effects. You will need as much history about a poisoning accident as possible, so that proper first aid can be started without delay. Poisons enter the body in 4 ways. Inhalation, through breathing. Injection, by puncture into skin. Absorption, through skin. Ingestion, swallowing. General signs and symptoms of poisoning. Distinctive smell of poisons, evidence of containers. The nervous system may be affected, causing slurred speech or drooling, impaired vision, uncontrolled muscle spasms, loss of balance, or paralysis. Shock may develop within minutes, hours, or even days. Level of consciousness will deteriorate, for example, dizziness, unconsciousness. Breathing may be affected. Difficult due to swelling, gurgling due to excessive saliva or fluids on the lungs. And the skin becomes cold, clammy. Treatment. Safety first. Gather information from the patient, bystanders, family, or the environment and try to identify the substance. Check the circulation, airway, and breathing, if necessary, and manage according to the assessment. Contact the nearest poison center or emergency medical service. Manage shock. Common symptoms. If the history does not reveal what poison was taken, or by what means it was taken, the signs and symptoms may be helpful in determining how the poison was taken. The patient could have the following symptoms. When taken by mouth: nausea, abdominal cramps, and vomiting. Discolor the lips. And cause burns in the mouth, or leave an odor on the breath. When absorbed through the skin. Reddening of the skin. May affect consciousness. Breathing. And pulse irregularities. When injected through the skin. Irritates the point of entry. Affect consciousness. Breathing. And pulse irregularities. When inhaled. Respiratory problems. Consciousness. Pulse irregularities. Coughing. Chest pain. And headache. Treatment. Call a Poison Information Center at Johannesburg 0116422417, or Cape Town 0216895227, or a doctor, and follow their advice. Swallowed poison should not be diluted. Wipe and remove any poison or corrosive residue from the person's mouth, and do not induce vomiting, unless on advice from the Poison Information Center. Inhaled poison such as gases should be cleared from the lungs as soon as possible and the person removed to fresh air. If breathing stops, continue with artificial resuscitation. Absorbed poisons such as liquid or powdered chemicals must be removed from the skin as quickly as possible by flushing the affected area with lukewarm water, and then washing the skin with soap and water. Injected poison should be contained near the injection site. Keep the casualty at rest and the affected limb at below heart level to delay absorption. Snakebite. The vast majority of snakes are not poisonous. Most of South Africa's snake-related attacks are under teenagers and younger children, because teenagers and children catch the snakes to be kept as pets. Only a small percentage of snake bites are dangerous, but you should consider all bites as dangerous. Make sure to obtain and record all information. In most cases, the snake strikes swiftly and injects venom below the surface of the skin into the tissues, which is then absorbed by the lymphatic system. Should you see a snake, leave it alone. Do not attempt to kill it, as the creature will defend itself vigorously. Stay clear of likely habitats, and always pay special attention to young children playing near long grass and bush. Research suggests that only around 15% of people struck by poisonous snakes are envenomed, but always treat for the worst case, and assume that venom has been injected. Common symptoms. A non-spitting cobra, mamba, and wrinkle spite need urgent first aid treatment. Their venom generally affects the nervous system and can affect breathing. The adder and spitting cobra snake venom usually cause severe local tissue damage, with loss of tissue fluid resulting in shock. The boomslang and vine snake venom affects blood clotting and may result in spontaneous bleeding. In all cases, the first aid treatment should be to restrict circulation and prevent the venom to circulation to the heart and brain. Puncture marks. Parallel scratches on the skin, rarely any pain. Anxiety. Pale, cool skin with progressive onset of sweating. Rapid, weak pulse. Rapid, shallow breathing. Breathing difficulties. Blurred vision, drooping eyelids. Difficulty swallowing and speaking. Abdominal pain. Nausea and/or vomiting. Headache. And collapse, progressing to a comatose state. Treatment as per Tygerberg Poison Information Center. Before leaving on a hike, climbing, mountain biking, or camping trip, find out where the nearest medical facility is, and note the telephone number. In the case of a snake bite, get the patient to a medical facility as soon as possible. Phone ahead to notify them of the arrival of a snakebite victim. Note that, in most cases, you have a couple of hours before serious life-threatening symptoms manifest themselves. Immobilize the patient if possible. If alone, keep calm and do not walk too fast, or run as this speed up the distribution of the venom. Do not suck the bite site. Do not apply a tourniquet. Only in suspected neurotoxic bites, for example the mamba, Cape cobra bites, is it recommended that you apply a wide crepe bandage firmly above the bite site, as tightly as for a sprained ankle, to slow the spread of venom to vital organs like the heart and lungs. The life-threatening neurotoxic effects of mamba and Cape cobra bites, such as difficulty in breathing, develop within 30 minutes to 4 hours. If you are more than 2 hours away from medical assistance, respiratory support, for example, mouth-to-mouth resuscitation, may be necessary. The life-threatening effects of a cytotoxic snake bite, for example, puff adder, develop late. It may take 6 to 24 hours. Comforting and reassuring the patient is an especially important part of the first aid treatment. Try to get a good description of the snake. Note: antivenom should only be administered by the trained medical staff in a medical facility. Food poisoning usually caused by contaminated food. Common symptoms. Starts a few hours or days after the contaminated food has been ingested. Headache, nausea and vomiting, stomach ache, and diarrhea. Household products. Common symptoms. Possible burn wounds, rash and swelling around the mouth. Difficult breathing, and odor on breath. Stomach ache, vomiting and diarrhea. Poisonous plants and mushrooms. Common symptoms. Excessive saliva, very thirsty and excessive perspiration. Palpitations or cardiac arrest. Altered level of consciousness, hallucinations, convulsions. Treatment. Do not induce vomiting, unless ordered by a doctor at a poison center. Continue with general management of poisoning.